Traumatic brain injuries are a leading cause of morbidity, mortality, disability, and socio-economic losses in India and other developing countries. The Indian population figure is about 126 crores and the estimated figure of death every year in India is nearly 2.5 million. Whereas the incidence of TBI is about 160 per 1 lakh per year and the mortality rate is about 20 per 1 lakh. The incidence of hospital contact is about 2 million and the hospitalizations taking place is about 1.6 million. These are staggering numbers and an area of major concern that inspired leadership at AAPI, American Association of Physicians of Indian Origin, the largest diverse professional association in the United States, to connect with experts, government, private sector and NGOs to bring them together in working and developing purely India-centric guidelines to address this challenge. AAPI initiated this project with the overall objective to create a set of guidelines that can be used by healthcare professionals to implement evidence-based, best practice care of individuals who incur a traumatic brain injury (TBI), covering all aspects starting from prevention to pre, in-hospital and post-hospital care. The sole objective is to establish evidence-driven state-of-art care across the country, which is standardized so that the people from all strata get similar care. Currently in India, there is a lack of optimum care and not a clear understanding on the best practices or what is optimum care. As we all know, trauma is a 100% preventable problem, and it is also one condition where post-trauma care means a significant social, economic burden on patient and family. Lack of best practice for treatment of those who do not experience spontaneous recovery is not clearly defined. Therefore, the following questions needed to be addressed. Can an approach be devised to wherein effective prevention by means of stricter laws on road safety be enforced, or Good Samaritan law be enforced, or can we have a functional identification of levels of trauma and victim or patient be transported to the nearest centers based on his or her injury? Can a complete management plan be developed not just at the center but also in terms of what rehabilitation strategy can be developed so that the best integration in social life is possible post-acute care? Can we also have training plan to enhance our inadequate paramedic staff and also first point of contact? These questions were addressed head-on by 40 leading experts in neurosurgery, trauma, rehab and prevention on December 27th and 28th, 2014 at the historic First India Trauma and Brain Injury Advisory Council established by AAPI USA under the leadership of Dr. Ravi Jahangir, President of AAPI, under medical guidance provided by Dr. Raj Narayan and Dr. Jogi Patisabu. Also superbly moderated by the AAPI Honorary Advisor, Mr. Anwar Feroz Siddiqui.
What we do for India, since most of us have a feeling that we need to give back to our motherland, is we come here and find out what the needs are, and it's called a needs-based. So when you come to here and check for the needs of India, the last year we were given the impression that the traumatic brain injury and car accidents is a major issue, and then of course now we find out that it is the worst in the world. So taking that, we go back and we check all over the world and mostly from USA, and we bring the best authorities to address these issues.
The reason for guidelines is that it helps to get things organized, and it has been shown in many studies that it improves the outcome and the mortality from head injury. Of course, not just saving lives, but it improves the quality of the survivors.
This is like a dream come true. we've been working on this for 7 years. 2009, about 100 neurosurgeons came to the US. Then about 75 neurosurgeons from there came here to Jaipur, and we've been going back and forth. This idea of changing how we manage head injury in India, to learn from what the Indian experience is to the West, as well as import any good things back home. That is the step we're doing today.
We have to form certain guidelines for the first responders. Whenever there is an accident, what should the first responders who are at the site should be doing? What should be the paramedics be doing? What should be the EMT be doing? Are there enough trauma centers around? Are there level 5 trauma centers? Trauma centers go from level 1 to level 5. Level 1 is the one which are majority of the time very well equipped with 24 hours attendance from a neurosurgeon, with all the equipment there, with the CAT scan and everything. So how many of them are there around? So we have to form certain guidelines which will help the situation of any trauma occurring on the roads, on the highways. So this will probably help the situation of cutting down in the number of deaths due to trauma.
The loss of young lives or young people being affected in their productive age groups due to a preventable cause like road crash is something that we can all jointly address and make efforts to reduce them as we go along.
With our persistence and with our zeal and ability, we can one day hope to achieve the same thing throughout the country.
It's a real pleasure to be a part of something as amazing and as groundbreaking as the traumatic brain injury project, I call it for now. Ultimate goal is to develop India-centric guidelines.
In India, the diversity is not only in terms of geographical terrain, landscape, language, but also in terms of patient care. We have few centers of excellences like Nimhans or AIIMS, and some places where even in primary care center is below the optimum standard. This document aims to be a peer-driven living document which will evolve constantly and bring multiple stakeholders like government, policy makers, general public, road safety authorities, police, primary care center, proper gradation of trauma centers, fully equipped ambulances, trauma centers not just by equipments but also trained staff, and rehabilitation centers as a part of development and implementation of guidelines. With this objective, this is a first draft of India-specific recommendations on traumatic brain injury. The purpose of developing the guidelines is to improve patient care by creating a framework that can be implemented by health professionals across the country to effectively prevent, identify, and treat individuals who suffer from TBI.